During this presentation, we will talk about Capital Health Plan Retiree Advantage HMO. This plan is offered exclusively by your employer or former employer to Medicare-eligible retirees and their Medicare-eligible dependents. We offer 3 other Medicare Advantage plans that you may have heard of. They are Capital Health Plan Silver Advantage HMO, Capital Health Plan Advantage Plus HMO, and Capital Health Plan Preferred Advantage HMO. They are available to anyone who is eligible for our Medicare plans. They have attractive premiums but may have higher out-of-pocket costs than the Retiree Advantage plan we're talking about today. If you would like information on these plans, you may want to attend our Silver Advantage, Advantage Plus, and Preferred Advantage presentation as well. We are very proud of the fact that for 2024, Capital Health Plan has received a 4.5-star rating out of 5 stars from the Centers for Medicare and Medicaid Services. Medicare evaluates plans based on a 5-star rating system. Star ratings are calculated each year and may change from one year to the next. Additional information on plan ratings is available at www.medicare.gov and in your enrollment guide. You become Medicare eligible at age 65 or earlier due to a disability or end-stage renal disease, which is permanent kidney failure. To enroll in Medicare, contact the Social Security Administration. The address, office hours, and phone numbers are on this slide. You can contact the Social Security Administration up to 3 months prior to your Medicare effective date. However, you will automatically be enrolled in Medicare Parts A and B if you begin receiving Social Security benefits prior to becoming Medicare eligible. See our Medicare Made Easy brochure, which is located on our website, www.capitalhealth.com/Medicare, for additional information about how and when to enroll in Medicare. If you are 65 and have creditable coverage through an employer, you do not have to sign up for Part B when you become Medicare eligible. If you do not have creditable employer coverage, or when you lose creditable coverage, you must sign up for Part B, or you may incur a late enrollment penalty. With Medicare, you have choices in how you receive your medical and prescription drug coverage. You may choose to have Original Medicare through the federal government, which is Medicare Parts A and B. Because Original Medicare does not cover prescription drugs, individuals would need to purchase a separate prescription plan, which is Medicare Part D. Some individuals also choose to purchase a supplement plan called Medigap to pay any costs that Medicare does not cover. Capital Health Plan does not offer standalone prescription drug plans or supplement plans. Another option is to choose a Medicare Advantage plan, which is Medicare Part C, like Capital Health Plan Retiree Advantage. A Medicare Advantage plan contracts with the federal government to become responsible for your Medicare benefits and services. Our Medicare Advantage plan provides your hospital coverage and physician and outpatient services, along with Part D prescription drug coverage, all in one plan. You pay co-payments or co-insurance when you access services, and Capital Health Plan pays the healthcare providers. There are other options as well for individuals who have VA benefits or TRICARE. Capital Health Plan Retiree Advantage is an employer-sponsored plan offered exclusively to retirees who have Medicare and their Medicare-eligible dependents. This plan allows you to continue to participate in your group health plan after retirement. You can also continue to cover dependents who are not eligible for Medicare. The benefits and co-payments generally remain the same as those for active employees, although you will see some differences. See the summary of benefits, your plan's schedule of co-payments, and the formulary for additional information about the differences. You pay the premium for Capital Health Plan Retiree Advantage to your former employer, and you must contact your employer or former employer to learn the premium amount. To be eligible to enroll in Retiree Advantage, you must be entitled to Medicare Part A and enrolled in Medicare Part B. You must continue to pay your Medicare Part B premium to the federal government. This means you will pay both the Medicare Part B premium, which is typically deducted from your Social Security benefits, and the Retiree Advantage premium, which is paid to your former employer. You must live in the CHP service area, which includes the Florida counties of Calhoun, Franklin, Gadsden, Jefferson, Leon, Madison, Taylor, Liberty, and Wakulla. Certain plan options may be excluded, so please contact your group administrator through your employer for additional information. This slide explains when you enroll in Retiree Advantage. It may be the most important slide in this presentation. If you are the subscriber, which means the employee, you enroll when you retire if you are Medicare eligible, or if you are already retired, you enroll when you become Medicare eligible. If you are a dependent, you enroll when the subscriber or your spouse retires if you are Medicare eligible. If the subscriber or your spouse is already retired, you enroll when you become Medicare eligible. If the subscriber is still working for an employer who offers Retiree Advantage, then neither the subscriber nor the dependent will enroll in Retiree Advantage. You only enroll in Retiree Advantage when the subscriber is retired. Once you are retired and Medicare eligible, you must enroll in Capital Health Plan Retiree Advantage to remain enrolled with CHP through your employer-sponsored plan. You may be eligible for simplified enrollment, which means you can enroll by completing a short enrollment application instead of the full enrollment application. To be eligible for simplified enrollment, you must be a retiree or the dependent of a retiree and be eligible for Medicare. CHP will begin sending you a simplified enrollment packet beginning 90 days before you become Medicare eligible. We must be able to verify a physical address and enrollment in Medicare Part A and B. You can opt out of enrollment by not returning the simplified application. If you are not eligible for simplified enrollment, you will need to complete an enrollment application sometime during the 3 months prior to your Medicare effective date. If you are a state of Florida employee, you will submit the application directly to Capital Health Plan. In addition, state of Florida employees must contact People First for enrollment information. All other employer group employees can submit their applications directly to their employer or former employer's benefits department. Your guide to enrollment includes a summary of benefits and your plan's schedule of copayments. For each benefit listed, you can see what your out-of-pocket costs will be. The guide also includes an enrollment application, an envelope to return the application, an enrollment checklist, and additional information about our star rating. It's important to remember the enrollment checklist, which will tell you how to enroll. Please take the time to read the Guide to Enrollment for additional coverage and cost-sharing information. You will not need to use your red, white, and blue Medicare card while you are a Capital Health Plan member. When you enroll in Retiree Advantage, we will send you a new Capital Health Plan ID card that you will use to access all of your care, including prescription drugs. You are still enrolled in the federal Medicare program, meaning you have all the rights and protections of the federal Medicare program, while Capital Health Plan provides your Medicare benefits and services. You will continue using the same network of providers with a few exceptions. You must continue to use our network providers except in emergency or urgent care situations or for out-of-area renal dialysis. There are also times when you may receive prior approval to go to out-of-network providers. Routine care from out-of-network providers will not be paid for by Medicare or Capital Health Plan. This is the same as your current coverage. This slide shows the definition of a medical emergency and urgently needed services. The fitness benefit you are currently eligible for becomes an individual benefit and not a per-household benefit. A unique benefit for our Medicare Advantage members is the eyewear benefit. You can receive up to $200 reimbursement every year for the cost of eyeglasses or contacts. If you go to one of our eye care centers at Centerville Place or Governor Square, they will deduct this from the cost. Otherwise, you must submit receipts for reimbursement. You may see some differences in the formulary and how drugs are covered. The formulary is the list of covered drugs. It lists restrictions and cost-sharing tiers. Some drugs and high-risk medications may no longer be covered. Your drugs may be in different cost-sharing tiers and new restrictions may apply. We recommend that you review a hard copy of the formulary or go to our website at www.capitalhealth.com/Medicare for the most recent Retiree Advantage formulary to see how your drugs will be covered. Retiree Advantage plans have an added Select Care Tier 6 for Part D prescription drug coverage. The Medicare Select Care Tier 6 is a list of medications to help treat high blood pressure, diabetes, and cholesterol. All prescription drugs that fall within the Select Care Tier 6 have a $0 copay for retail and mail-order pharmacy. In addition, for Tier 6 mail-order prescription drugs, you have a 100-day supply option. State of Florida members will begin receiving their prescription drug benefit through Capital Health Plan. This includes mail order. You will use the same large network of doctors, hospitals, and pharmacies. You will not be negatively affected by the gap, the so-called donut hole in the prescription drug benefit, because the Retiree Advantage plans cover the gap. Emergency and urgently needed care is covered anywhere in the world. Most copayments remain the same, but there are exceptions. Please review your summary of benefits, schedule of copayments, and formulary. Some individuals with limited incomes and resources may be eligible for a federal program called Extra Help or Low Income Subsidy, which reduces prescription drug premiums and copayments or coinsurance. To see if you qualify for Extra Help, call Medicare, the Social Security Office, or Medicaid. The contact information is provided on this slide. This information is not a complete description of benefits. Contact the plan for more information. Benefits, premiums, and/or copayments, coinsurance may change on January 1 of each year. Limitations, copayments, and restrictions may apply. The formulary, pharmacy network, and/or provider network may change at any time. You will receive notice when necessary. Contact your employer or former employer to learn what other requirements they may have regarding your enrollment in Retiree Advantage. Contact your employer or former employer's benefits department if you move or for any other reason that may require you to disenroll. Capital Health Plan Retiree Advantage is an HMO plan with a Medicare contract. Enrollment in Capital Health Plan Retiree Advantage depends on contract renewal. This slide contains our contact information and hours of operation. Please feel free to contact us with questions or for assistance. Appointments are necessary to see a Medicare sales representative. If you have special needs, this and other documents may be available in other formats such as Braille or large print. Thank you. Please feel free to contact us with any questions.